Hi, welcome to Health Chat. I'm Dr. Alancia Wynn. So today we're going to talk about the things we do to ourselves, all these little injuries that we can do when we're working around the house or working out in the yard or in the gym, things like that. We're going to talk about sprains, strains, tendonitis. Now on the surface they're similar, but at the same time they're completely different. It'll make sense in the long run as we go along. So first we're going to talk about sprains and strains. So what a sprain is, it's a stretched or torn ligament. Now what a strain is, it's a stretched or torn muscle, but it can also be a ligament. So what's a ligament, you might ask? Well, what a ligament is, if you think about a joint, a ligament is the thing that holds the joint together. It's a piece of tissue that stretches from one side of the joint to the other, so it kind of holds the two bones together in the joint. So if you hear people talk about, ACLs and things like that sports athletes have, that's a ligament. That's an example of a ligament. So if you injure that, that's a sprain. If you injure the muscle, that's a strain. It's hard to get the two straight because they sound very similar, but hopefully by the end of today, it'll make a little bit more sense. Now, a sprain is most often in your ankle, your knee, your finger, because those are the joints that we tend to move more because they move in multiple different directions, but it can occur in any joint. Strains most often occur in the back or the hamstrings. The hamstrings are that big muscle on the back of your thigh, but again, it can be any muscle. So what are the symptoms of strains and sprains? The symptoms are basically the same for both. You can have pain or tenderness in the area of the injury. You can have some swelling. You can have redness. You can have some bruising in the area, and you have loss of the normal mobility. Now that bruising, sometimes it occurs right at the time of the injury. Sometimes it can occur hours or even days later, and so sometimes it can make the joint look like it's getting worse over time, even if it's not. And so what are the causes? Strains are usually caused by twisting, pulling, or overuse. You can think of like an ankle strain. Sprains, so like a back strain. See, even I get the terms mixed up sometimes. Sprains are usually caused by trauma, so falls, twisting injuries, car accidents, things like that. Now, the risks for both are the same. So anything that involves quick running, twisting, changes of direction, so like playing tennis or basketball, things like that. Also, you are at higher risk for developing these if you do any type of activities that put you at a higher risk for injury. Things like skateboarding, contact sports like football or soccer, skating, biking, skiing, rock climbing, but even exercising in a gym can put you at risk for these things if you're not using the proper technique, especially if you're doing weightlifting. But even on a treadmill, anything like that can do it. Being overweight increases your risk because that just puts more stress on the joints and the muscles. Any type of trauma, so falls, car accidents, injuries, getting hit by something or someone. If you exercise excessively, so if January 1, you're saying, hey, I'm going to work out an hour a day because that's my New Year's resolution, but you have not worked out since 1975, well, then you're going to most likely strain or possibly even sprain something. Poor conditioning, same thing. If you have not been really exercising and then all of a sudden you start doing a lot, that can increase your risk for developing it. But it doesn't even have to be exercise per se. It can be if it's the first nice day of the spring and you want to get out and get the yard working, or you out raking leaves in the fall and you are not someone who exercises regularly. Anything that you do that's excessive above and beyond your normal level of activity can put you at risk for sprains and strains. Poor fitting shoes can do it, either too big or too small, because they can make it difficult for you to walk, and that puts you at risk for injury. High heel shoes, ladies, especially the really high ones, the really thin ones, because it changes the center of gravity when you're walking. It makes you more unstable. Also, it puts you at risk if you're walking on an uneven surface. So if you're walking on a cobblestone street down in Old Town Alexandria, or if you're walking across a grate or manhole cover, or just an uneven sidewalk, any of those kind of things that makes you at risk for not being stable when you walk, puts you at risk for sprains and strains. So we talked about the things that put you at risk. So how do you prevent these injuries? The number one thing is to maintain a good level of physical fitness, because if your muscles are strong, your ligaments are in good shape, it's much less likely that if you're going out and doing things that you're going to injure yourself. You want to maintain a healthy weight, which, as I said before, being overweight, it puts more stress on your joints, your ligaments, and that increases your risk for developing an injury. Also, if you are going to start exercising, say if you have not been exercising and you want to start exercising, you want to gradually increase the activity level. You don't want to go from 0 to 60. You want to go from 0 to 10, and then from 10 to 20, and then from 20 to 30, slowly. You don't want to do too much too soon. And anytime you're exercising, you want to be sure that you stretch before and after you exercise. So another way to avoid injury is you want to wear the proper shoes. You want to make sure that they fit properly. You want to avoid those really high, really narrow heels. And you want to use the appropriate protective gear appropriate to your activity. So if you're skiing or if you're playing a sport, you want to make sure that you're wearing the proper activity. You want to make sure you're wearing the proper footwear especially. Because if you're doing an activity that involves a lot of cutting, a lot of twisting and making sudden turns and sudden movements, you want to make sure that you're wearing shoes that are appropriate for that, because shoes that are designed for running are designed to keep your foot going straight forward. And if you're doing something that your foot is going to be doing a lot of twisting and turning like that, running shoes are not the proper shoes, because they're going to put stress on the sides of your feet, and that increases your risk for twisting your ankle or spraining your ankle, because you're not getting the proper support for all of that side-to-side movement. As I said before, you want to stretch before and after any exercise, because if your muscles and your ligaments are cold, they tend to be tighter. You can kind of think of it like a rubber band, where it can be really short and then you gradually stretch it out, and then it gets looser, and then it's easier for you to stretch it further. Whereas if you try to just stretch it initially, it may not stretch as far, or it may even break. Same thing with your muscles, same thing with your ligaments. And after exercise, it's important to stretch, because you want to cool down. And you want to, another thing that stretching after exercise does is it improves your flexibility while your muscles are already warm, so you get more of a stretch. So that improves your flexibility, decreases your risk for injury later on. And you want to strengthen any weak muscles with special exercises. So if you know that you have weak muscles in your back, you want to do exercises that will strengthen your back. If you know you have weak muscles in your legs, you want to do muscles that will strengthen those muscles. So, and that leads me to another point. You also want to be sure that if you are going to start an exercise program, that you work with someone who knows what they're doing. You work with a trainer before you just start, especially if you're going to be doing any type of weight training or using any type of machines or anything like that. Because if you use them incorrectly, if you use poor form, if you use too much weight, that increases your risk for sprains, strains, other injuries as well. Because if you're using the machines or the equipment incorrectly, you're not using the correct muscles, or you're using the muscles in a way that puts them in a position that they're not at their strongest, and that puts you at risk for damaging that muscle or pulling those ligaments, causing those sprains. So anytime you're going to start an exercise program, you want to talk to someone who is knowledgeable about exercise to prevent the risk of any type of injury. And you want to make sure that you accident-proof your home, especially important for the elderly, but it's true for anybody. Anytime you have any throw rugs, you want to make sure that they're tacked down with rug tape. You want to avoid having any loose extension cords running across the floor where you might trip and twist your ankle, sprain your ankle. You want to make sure that the rooms are lit well. You want to make sure that there's nothing that is sticking out that you might kind of twist your back as you're trying to avoid or go around something. So you want to just take a moment and look at your home with a new eye, as it were. Because sometimes when we're in our homes long term, we don't see the things that are putting us at risk. Bathroom is another place. You want to make sure that there are rugs that are not going to slide when you're getting out of the bathtub or the shower, because that can cause a slip that can cause a fall, that can cause a sprained ankle, that can cause a strained back, that can cause those type of injuries. If you have any concerns about how you accident-proof your home, there are certainly plenty of physical therapists and occupational therapists and people that will come out and do what's called a home safety assessment. Again, especially important for the elderly, so that they can make sure that they point out all these potential risks for falls and injuries, and they will help you solve those problems. So how do you diagnose either a sprain or a strain? Well, as a layperson, you really can't, because as I said at the beginning, the symptoms are pretty much the same. You get pain, you get swelling, you can't put weight on the body part if it's a lower body part, if it's a leg or a knee or an ankle. If it's a shoulder, you may have trouble moving your arms. If it's a wrist, you won't be able to move your arm or right or things like that. So it's really hard for you to tell whether it's a sprain, whether it's a strain. So my suggestion, if you have any type of injury like that, is you get examined by a physician. Either go to an urgent care facility or emergency room, or your local regular family physician. And they will do an exam, and they will be able to tell whether it's a sprain, whether it's a strain. They may want to do x-rays if they think that there's a potential that there may be something that's broken. They may not, depending on if it's pretty clear-cut that it's a sprain, they may not need to do any x-rays. But the main thing is they want to examine to make the proper diagnosis, because you have to get the right diagnosis to get the right treatment. So how do you treat sprains and strains? It depends on the severity of the injury. Primarily, you may have heard of the acronym RICE, R-I-C-E, and that's primarily what we use for these type of injuries. It stands for RICE, for rest, ice, compression, and elevation. So what that means is you want to rest the injured body part, and you want to reduce your activity as much as possible. You may need, if it's a lower body, if it's ankle, knee, foot, you may need a cane, or you may need crutches to avoid putting any weight on that injured area, because the more weight you put on it, not only does it hurt, but that's not allowing those areas to heal. So you also want to use ice on the area, because that will help with the swelling and it'll help with the healing. Now, when you put ice on an injured part, you don't want to put the ice directly on the skin. You want to have an ice pack or a bag of frozen peas or whatever you're using for your ice. You want to cover it with a thin towel and then put it on the injured area. And you want to put that on the injured area for 20 minutes at a time, every 2 hours. You don't want to put it on there any longer than that, and you certainly don't want to put it on there any more frequently than that, because if you apply ice too long or too frequent, that increases your risk for actually developing damage to the skin, potentially even frostbite, depending on how long you leave it on there. After 24 hours, if the swelling is better, then you can either continue ice or you can switch to heat. Heat primarily is for muscle injury, so it's really more for strains as opposed to sprains. So if you have a sprain, which again is more in the joint itself, you want to continue the ice until the swelling is gone, until the pain is getting better. And so if you just think about it in the future, ice is for swelling, heat is for pain. So if you have muscle pain, you want to use heat. If you have swelling, you want to use ice. I get that question a lot. So ice for swelling, heat for pain, especially if you think it's coming from muscle, you want to use heat. And the C in the RICE is compression. So that means using an ace bandage to wrap the injured area. And what that does, it makes it feel better because it kind of keeps it tight, so it makes it harder for you to move that injured joint. But it also helps with the swelling, because if you wrap it down tight, that decreases the swelling that you get, especially if you wrap it early in the injury. You injure yourself and you get it wrapped pretty quickly, you definitely have less swelling the sooner you get it wrapped. Now, when you're using an ace bandage, you want to have it tight enough to where you feel like there's some support, but you don't want it so tight that you feel like you're cutting off the circulation. So if you're wrapping a joint, either an ankle or a wrist, and your fingers or your toes are starting to get cold or starting to turn blue, well, you have it too tight. And you don't want that, because not only will it hurt after a while, because those toes will start to hurt, but it'll also potentially even cut off the circulation and cause permanent tissue damage if you leave it. So it's hard to say exactly how tight you need it, because everybody's a little bit different. but you want it tight enough to where you feel like it's on, because you obviously don't want it so loose that it's just not doing anything, because then it's not doing you any good. So you may have to wrap it a couple times to get it to the proper tightness. And you want to leave that wrapped up anytime during the day you potentially can be up and about. You don't want to have it wrapped up at night. You can certainly take that ACE bandage off when you go to bed at night. If the injury is severe, you may need more compression than what you can get from an ACE bandage. And in that case, your doctor may use a cast, they may use a splint. Sometimes splints are made out of metal, sometimes they're made out of plaster like a cast, so it's almost like a half cast. Sometimes they can be made out of air, so it's almost two air cylinders that fit on either side of the joint. They get inflated. Sometimes if it's even more severe than that, they may, especially if it's an ankle, they may put you in a walking boot, which is almost like, you can almost think of it like a ski boot. So it's made out of heavy plastic, and it's the most support you can get without being in a firm cast. But you can still take it off at night and take it off to bathe and things like that. So that's based on the severity of the injury. And sometimes you don't know how severe the injury is at the beginning. You may start off with an ACE bandage, but it's not getting better, and so you move up to one of these other ways of getting it compressed. And as you go through the healing process, as things get better, if you're in a boot, you may be able to move down to something smaller. And then the E is for elevation. So you want to elevate the body part above the level of the heart to reduce that swelling. Anytime you're sitting or lying down, you want it propped up on some pillows. The most common medicines we use over-the-counter medicines. So you can use Tylenol, you can use over-the-counter anti-inflammatories, things like ibuprofen or naproxen. And if your injury is to the point where you need to have physical therapy or any type of rehabilitation, you want to begin that as soon as possible after the injury. The goal is to return you to complete function and return to full activity. And again, that depends on the severity of the injury. If it's a minor ankle sprain, you don't need physical therapy. But if you do need, if it is a more severe injury, you definitely want to get that started as soon as possible. Tendonitis is similar, but the injury involves the inflammation of a tendon. Now, what a tendon is, it's the cord that connects a muscle to a bone. So it's still this kind of thin material like a ligament, but instead of connecting bone to bone like a ligament does, it connects muscle to bone. So the symptoms of tendonitis are the same. You get limited movement, you get pain, you get swelling, you get tenderness, you may have bruising, but it can also involve weakness because it involves a muscle. Common sites of tendonitis are your shoulder, your elbow, the Achilles tendon of the heel, or the hamstring. Again, that's that muscle in the back of your thigh. The risks for tendonitis are pretty much the same. You can get tendonitis from an injury. You can get tendonitis from overuse. You can get tendonitis from incorrect movement during an activity, especially with repetitive motion, like tennis elbow. So if you're doing the same thing over and over again, but you're not using good form, you can inflame the tendon, and that is what tendonitis is. Some joint diseases like rheumatoid arthritis or gout can increase your risk for tendonitis and cause it. And just normal aging, as your tendons get thinner with aging, that increases your risk for injury. So how do you prevent tendonitis? Pretty much the same way you prevent sprains and strains. You want to build up to activity as you're doing something new. You want to avoid overusing those muscles and tendons. You want to learn those proper techniques for exercise or a sport, especially if you're new. You want to because if you get into the habit of doing something when you first learn and it's wrong, it's harder to relearn than to learn it right the first time. So anytime you're starting something new, it's a good idea to get that proper education in the proper form, the proper technique. And same thing with sprains and strains. You want to wear the proper gear for whatever activity you're doing, whether it's a sport, whether it's working out in the yard, whatever you're doing. Treatment is the same. Back to that same RICE, that rest, ice, compression, and elevation. Depending on the body part, you may want to use a sling. So if it's an elbow or a shoulder, you may want to put it in a sling. So just like you would rest an ankle or a knee by using an ACE bandage, you would use a sling to rest an upper body injury. You might use cane or crutches to take the weight off to avoid putting pressure on it if you need it for comfort. Treatments are the same, Tylenol over-the-counter anti-inflammatories like ibuprofen, naproxen. Sometimes tendonitis, the difference between tendonitis and a sprain or strain is that tendonitis can sometimes become chronic, especially if it's related to a long-term overuse situation, or if it's related to arthritis or something like that. If it is a chronic tendonitis, the treatment is a little bit different. It's a little bit more involved. Sometimes you need to have steroid injections into the tendon because, again, tendonitis is inflammation. Steroids will decrease that inflammation. So if you're taking an anti-inflammatory like ibuprofen, that's decreasing the inflammation. If that's not working, the next step would be a prescription anti-inflammatory. If the prescription anti-inflammatory is not working, you might need to do a steroid injection right into that tendon, right into that joint to decrease the inflammation right in that area. If the steroid injections are still not working, a lot of times you need to do physical therapy, and if the physical therapy is not helping, then the last resort, you may need to have surgery to correct it. Sometimes with chronic tendonitis, the tendon can become weak and it can actually start to fray, or it can actually even tear. And if it tears, then that definitely is more severe, and that's when you start getting into that, maybe needing surgery to repair that, maybe needing physical therapy. It becomes more of a bigger issue to take care of rather than just resting it. Because at that point, if you're talking about a partial tear in the tendon, that's not something that's going to get better with just rest. But just like with sprains and strains, you do want to resume regular activity as soon as possible as the pain starts getting better, whether it's acute or chronic. Primarily in the acute tendonitis, you want to get back to regular activity, not necessarily anything that is severe. So if you injured yourself by lifting weights in the gym, you don't necessarily want to get back to lifting weights in the gym until you're pain-free, but you want to get back to work. You want to get back to your normal daily activities as the pain gets better, because you want to start using that joint as soon as possible, preferably within 3 to 4 days of the injury, because you don't want to get stiffness in the joint. Because if you don't use the joint for an extended period of time, you can start to develop stiffness, and that stiffness can get worse and worse over time if you don't use it. The worst case scenario long-term of a stiff joint is what's called a frozen shoulder. And what that means is you basically have scarring around the joint of the shoulder from not using it, and then it becomes impossible to use it. And that's why it's frozen. So the sooner you can start using the exercise, just moving it around, even if you don't want to do exercise with weights, you want to move it as much as possible to avoid that stiffness. And you want to, as you're getting more active again, if you start having more problems, if you start having more pain, obviously you want to go back and see your physician, find out if there's something else going on. Is there a tear that they didn't realize was there before? Is this involving more than just one tendon? Because you can have tendonitis in more than one tendon of a joint, because most joints have more than one tendon because they have more than one muscle that goes to that joint. So it all depends on everything that's going on. So you want to resume regular activity as you can, and then as the pain gets better, start doing more and more, eventually getting back to your full exercise routine, your full normal activity. But as I said, anywhere along that process, if things seem like they're backsliding, things start getting worse again, you definitely want to check in with your regular doctor. Now, sprains, strains, and tendonitis are all, as I said, pretty similar. They all involve inflammation around a joint or of a muscle or something from overuse. Most times they are minor. They're just more of a nuisance because they keep you from doing the things you want to do. They make it difficult for you to go to work. They make it hard to get out of bed, things like that. But most times they resolve without any long-term effects, without any long-term problems. But the key to any of them is prevention, because anytime you injure a muscle, anytime you injure a joint, it's more likely that you could injure it again in the future. So the more you can take care of yourself, the better off you are long-term. So regular activity is definitely the way to go to keep those ligaments and tendons and muscles strong so that you are less likely to injure yourself So you don't want to be inactive all winter and then when spring comes suddenly jump up and try to do the things you did back in the fall before when you haven't done anything for 6 months. It's ideal you want to be active year round, or if you can be active year round, then when you start your new activity in the spring, you want to gradually ramp it back up as opposed to thinking you can do the things you did 6 months ago, because that's just setting yourself up for injury. And your primary care doctor, your family doctor is definitely the place to start for these type of injuries, because most times they're the ones that can take care of it. It's rare for these type of injuries that you need to go to see a specialist. But if it's a severe injury, especially if it's something that's lasted a long time, it's becoming more of a chronic problem, or if you need more compression than an ACE, so if you start needing to use those boots and splints and things like that, that's when you need to see an orthopedic surgeon, because they're a specialist in those areas. But anytime you have any type of injury like that, start with your family doctor, because they're the ones that can get you started on that road to health. So I hope this helps explain a little bit more about those type of injuries. Hope you have a little bit more better understanding than you did half an hour ago. And if you have any questions, definitely talk to your family doctor about it. I hope you had an enjoyable time. I hope you learned something. I'm Dr. Alancia Wynn, and this has been Health Chat. See you next time.